Good afternoon, everyone. My name is Dr. Atwal. I'm the Deputy Chief Provincial Public Health Officer for Manitoba. There's a lot to talk about today, and things are rapidly changing and evolving. We will do our best to cover everything and answer your questions. The public health orders currently in place went into effect Tuesday morning. A few things to highlight. Ahead of the holidays, private indoor gatherings are limited to 10 additional people, plus the household, if all are fully vaccinated. Youth under the age of 12 are exempt from needing to be fully vaccinated. Private indoor gatherings are limited to 5 additional people, plus the household. If any of the individuals ages 12 and older are unvaccinated, youth under the age of 12 are exempt from needing to be fully vaccinated. Outdoor gatherings at a private residence are limited to 20 additional people, plus the household, if all are fully vaccinated. Youth under the age of 12 are exempt, needing to be fully vaccinated. Outdoor gatherings on public property are limited to 50% of the usual capacity if all in attendance are fully vaccinated. Youth under the age of 12 are exempt from needing to be fully vaccinated. And outdoor gatherings on public property are limited to 50 persons in total if anyone present is unvaccinated. Youth under the age of 12 are exempt from needing to be fully vaccinated. Faith-based gatherings are limited to 50% capacity with proof of vaccination. When proof of vaccination is not required, faith-based gatherings are limited to 25% capacity or a total of 25 people, whichever is lower. Cohorts for faith-based gatherings may be implemented where groups can be physically divided up to a maximum of 10 cohorts or 250 people. We are concerned with what we are seeing in other provinces and jurisdictions related to Omicron. These new orders are in place to help us all stay safe and reduce the spread of the virus and Omicron. This holiday season, Manitobans should continue to follow public health orders, limit contact with others, focus on the fundamentals to limit the spread of COVID-19, including variants, and protect themselves and those around them by getting fully vaccinated or going for your 3rd dose as soon as you are eligible. Being fully vaccinated is your number 1 defense against COVID-19. No vaccine offers 100% immunity, but studies show that serious outcomes such as hospitalizations and deaths are reduced if you are fully vaccinated, and even better if you had your 3rd dose. However, Manitoba is now offering monoclonal antibody treatment to individuals who test positive for COVID-19 and have no prior antibodies or proteins in their system, a one-time treatment to boost your immune response to the virus. While not a substitute for vaccination, monoclonal antibody treatment can help reduce the risk of hospitalization from COVID-19 in those that are at high risk of severe illness. The treatment gives the body temporary antibodies to help the immune system fight infection. It is the first treatment to be offered to outpatients in Manitoba and is administered by intravenous infusion or through a vein within 7 days of symptom onset. Early testing is important as a treatment is only effective in the early phase of the infection. You also need to meet criteria, which include having a positive COVID-19 test and have symptoms that began within the last 7 days, and be unvaccinated or partially vaccinated, and have no history of COVID-19 infection, and be older than 40 years of age. Or you may also be eligible if you are 18 or older and have a health condition or are immune compromised due to a medical condition or treatment, regardless of vaccination status or previous COVID-19 infection. Additional criteria may apply. HealthLink's InfoSante will assist you to find out if you qualify to receive monoclonal antibodies. If you are eligible, you will be referred for treatment. More information can be found at manitoba.ca. Before I pass it over to Dr. Reimer, I want to wish all Manitobans a happy and safe holiday. I know this is not how we wanted to celebrate again, but please be kind and be safe. Thank you, and I will pass it over to Dr. Reimer.
Thank you, Dr. Atwal. Good afternoon. I'm Dr. Joss Reimer, Medical Lead for the province's Vaccine Task Force. I'd like to provide an update on the Protect MB vaccine campaign so far. A total of 2,378,890 doses of vaccine have now been administered in Manitoba. That includes over 55,000 doses given to children aged 5 to 11. As of today, 44.3% of all eligible Manitobans aged 5 to 11 have received at least one dose of the vaccine. 87% of the population over the age of 18 are now fully immunized, and 89.4% of the adult population have received at least one dose. Today in our province, 7,601 doses are scheduled to be given. Manitoba's online vaccine dashboard will be updated in the coming days to include updated statistics about third doses as well as the current information. December continues to be a very busy time for vaccinations in our schools. So from December 1st through the 15th, a total of 6,031 doses have been administered in schools. Over that same time period, December 1st to December 15th, after the holiday break is over. Please note that many regions are still working on finalizing their schedules for after the holiday break, and they will be able to share those schedules with families after the break. To have the fullest protection possible against COVID-19 going into the holiday season, Manitobans are urged to get their second and third doses as quickly as possible. The timeline between second and third doses has been shortened for some individuals. So anyone aged 60 or older, or anyone aged 18 or older who lives in a First Nations community who received their second dose on or before July 10th are encouraged to receive their third dose as soon as they possibly can. The older that you are and the more health conditions that you have, the more critical the booster dose becomes. We will not be able to prevent an Omicron wave. But what we can do as Manitobans is reduce how many people experience severe outcomes by decreasing our risk of transmission, but more importantly, by boosting the immunity of those who are at highest risk. A 6-month timeframe between second and third doses continues to be recommended for most eligible Manitobans. Eligibility for first and second doses of the COVID-19 vaccine continues to be anyone aged 5 or older. Second dose appointments can now be made for children aged 5 to 11. The interval between first and second doses must be a minimum of 8 weeks, or a minimum of 21 days for children living in First Nations communities. All adults aged 18 or older can receive a third dose of a COVID-19 vaccine as soon as they are eligible, and for most people, that's 6 months after their second dose, at any location that offers the COVID-19 vaccine. The National Advisory Committee on Immunization continues to recommend that a complete series of an mRNA vaccine, such as Pfizer or Moderna, is preferable to receiving a viral vector vaccine like AstraZeneca or Janssen. Manitoba is following national guidance that, out of an abundance of caution, young people aged 12 to 29 should get Pfizer for their first and second doses and possibly even third dose. This really is out of an abundance of caution, and it's because of the risk of myocarditis. Myocarditis is extremely rare, and it is a temporary swelling of heart tissues, but it appears to be lowest with Pfizer compared to Moderna. But both of these vaccines are safe and effective. Myocarditis is still very rare with Moderna. So if only Moderna is available, or if you choose to receive Moderna, it's still a very safe and effective option. In fact, some studies have shown that it may provide stronger protection and might be the preferable vaccine for those who are immunocompromised. We're certainly following those studies very closely to help Manitobans be as informed as possible as they make these decisions. I'd like to shed some further light on Omicron to help us all understand this variant of concern a little better in the context of vaccination. So the Omicron variant has some features that are concerning to scientists when it comes to the effectiveness of the vaccine. We know that the vaccines will still help to protect you, especially against severe outcomes, but we don't know exactly how much protection they will offer after 2 doses or after 3 doses. Early antibody studies are suggesting that any decrease in protection against Omicron after 2 doses can likely be overcome by getting a booster. That's because when you get a booster dose, your body gets flooded with antibodies, bringing the antibodies to a much higher level even than what you had right after your second dose. So while a smaller percentage of the antibodies will effectively recognize Omicron, when you have such a high number, it still means that there will be a large number of antibodies that will work and be able to protect you. I've said before that antibodies are not the only part of the immune response that works against Omicron. T cells, for example, are also very good at preventing severe outcomes. For vaccinated people, even after 2 doses, it looks like T cells are still good at recognizing Omicron. T cells are one reason why, even if you do get infected after being vaccinated, you're less likely to get severely ill. This does not decrease the need for a booster, however. The booster will increase your antibodies to prevent infection overall, but also increases the other parts of the immune response, like the T cells, and makes T cells even more effective. The province continues to do a lot of work to expand our capacity to deliver the vaccine in communities across the province over the holidays and into the new year. By reallocating staff to make more appointments available at provincial vaccine clinics, every day we are adding more and more appointments in health regions around the province. One new thing we're also doing is connecting with medical students who are currently on holiday and asking them to come and work as immunizers over this critical time period. Since there is more than ample supply of the vaccine available, the opportunity to book a timely appointment online or through the provincial call center is available to you, and you should check regularly because we will continue to open up new appointments. But perhaps even more conveniently is calling your doctor's office or calling your local pharmacy to see if you can get a quick appointment or if your location accepts walk-ins. Pharmacists and doctors have administered over 40,000 doses of COVID vaccine in the last week, and they'll continue to work hard to provide that service to Manitobans. Yesterday, additional vaccine shipments started being delivered to pharmacies and clinics around the province. So some of those locations that may not have been able to serve you before are now putting plans into place and may be able to serve you going forward. Something as simple and quick as a phone call can answer your questions about the possibility of a same-day appointment, a walk-in appointment, or an appointment to be booked in the future. Provincial vaccine clinics have a limited number of walk-ins, and in some cases, we're seeing that they fill up shortly after opening. Also, not every provincial vaccine clinic offers walk-ins. So that is something that you'll want to check on before you make plans. Because the vaccine is available in hundreds of locations, and it being the holiday season, you might have to call to find a dose near you. If you don't get an appointment as early as you would like, you should check back, because we are adding more and more appointments daily, and the same thing is true of our partners in pharmacies and clinics. Holiday hours for our provincial vaccine sites range from region to region, but all will be closed on December 25th and 26th and on January 1st. The sooner that all Manitobans receive their second and third doses, the sooner all of us will be better protected and boosted to shield us from COVID-19 and variants of concern such as Omicron. I'd like to remind parents and guardians of children aged 5 to 11 that you can book your child's first vaccine dose appointments, and you can also book kids aged 5 to 11 for their second doses, which they're eligible to receive 8 weeks after they got their first dose. You don't need to wait. You can book now to ensure your child gets his or her second dose at the 8-week mark instead of after. With the expected rapid rate of transmission with Omicron, Manitoba students need to be fully vaccinated as soon as they are eligible to protect them, to protect their fellow classmates, their teachers, and the whole community when they go back to school in January. Recent studies are demonstrating that the vaccine does help protect you from Omicron. One piece of emerging news about Omicron and the Moderna vaccine is that they recently announced a preliminary study about antibodies. The Moderna study showed that a third dose of the vaccine appeared to significantly increase antibodies that can help fight off an infection with the Omicron variant. Moderna said that lab tests showed Omicron neutralizing antibodies were low after 2 doses, but when the individuals were tested again a month after receiving their booster, they saw almost a 40-fold increase in the level of neutralizing antibodies that could recognize Omicron. This is very hopeful. However, new research needs to be taken cautiously, and we look forward to seeing more studies. But it does suggest that if you get a third dose of Moderna, you can lessen some of the pressure that we all feel about Omicron. The third dose will help you be better protected, not to mention protecting others and helping to reduce the strain on our healthcare system. As the holiday season is now upon us, my hope for all Manitobans is that we will remember our responsibility to care for ourselves and care for each other so that we can look forward to a brighter new year with more health and more hope and more peace for all of us. So thank you so much for listening today, and we will now take your questions.
Thank you, doctors. A reminder to our reporters on this session, you will have one preliminary and one follow-up question. Up first this afternoon from the Canadian Press, Brittany.
Good afternoon, doctors. Just wondering, we're seeing, and especially with today's numbers for reported cases, one of the highest numbers in the past few months, and we're seeing in other jurisdictions, they've already tightened restrictions, even more so than what they originally announced. Why, I guess, are we not seeing that in Manitoba? And I guess what point would we need to get to see even further restrictions being tightened?
Thank you for that. So you're definitely right. Our case numbers have gone up. I think when we look at what's happened in the past 7 days, our trailing 7-day average has gone up 60% roughly. We're roughly about 280 cases per day right now on average. A week ago was 175. Last week we made an announcement on Friday in relation to changing the orders. Those were just enacted on Tuesday. But even during that time, between Friday and Tuesday, we have been discussing what else public health needs to do to help protect the acute care system. So we're having ongoing meetings about that. It's a rapidly evolving situation. So things have changed quite dramatically, really quick. And we're gathering that information to determine those next steps on what public health does recommend in relation to the orders and what we recommend to government in relation to that as well.
Just to follow up then, how do you determine what is, I guess, your guys' baseline for saying, we need tighter restrictions?
Well, we have to look at a number of different things. There's cases. So right now, we're seeing a lot of Delta virus as well. We still have some unknowns related to Omicron. Omicron is here. We know over time Omicron will become the dominant strain. And, on a day-to-day basis, we're seeing increased numbers of Omicron positives in our samples as well. We still don't know, in general, the severity of Omicron in relation to severe outcomes. So we're still understanding that and trying to get information that from other jurisdictions. We might have some early information. There's some small studies that have some competing results in relation to how severe Omicron can be. We're working with national partners as well, and our medical officers of health, medical departments right across all the provinces to understand risk as well. There's no specific, case number trigger here where we look at in relation to orders and what is recommended. We have to look at an overlying risk assessment. So that involves what is circulating. That involves what adherence we have to the orders right now. That involves case numbers. It involves test positivity. And most importantly now, it involves how things have decoupled with vaccinations, but what is the risk on the acute care system? And the newest variable here is Omicron. So there's a lot to go through, a lot of evidence and science to review. And again, once we have more recommendations, those would be made public.
From CTV Winnipeg, Michelle.
Hi, Dr. Atwal. I'm wondering how many Omicron cases are there confirmed in Manitoba now?
I don't have that number in front of me, but we can get that number for you. But we are seeing greater numbers, and on a percentage basis, a greater percentage of our cases are becoming Omicron and Omicron positive. So our lab tests, will show a COVID-19 infection. There afterwards, there's a screening test that's done, and there afterwards, genetic sequencing is done. So we are presenting the genetic sequencing results to the public, and I believe those should be available, and we'll try to get you that number.
Thanks. Also about the holiday schedule for giving people updates, why have that 4-day lag where there's going to be no reporting on daily cases? Let's say there's like hundreds of cases a day. It might affect how people decide to go to group gatherings. So why are we doing that, and would you reconsider it?
I think we have to look at where we're at right now. In 1 week, our case numbers have gone up 60%. We're averaging 280 cases per day. The prediction here, I think we're going to continue to see cases in the hundreds of days, hundreds per day right now for the next period of time. So if you're basing, should I interact with someone because there's only 50 cases today versus 150, I think that's the wrong message. The message should be, we need to limit our interactions. We need to create a smaller group of individuals that we could interact with as per the orders. And even with that, the orders allow what they allow is sort of the maximum. What we should do is try to, if you are going to interact with another household, try to consistently interact with that household for the entire holidays versus having multiple households come through. Every interaction we have poses risk. The greater number of interactions we have with the greater number of people and greater number of households exponentially creates risk. With Omicron, we know it is much more infectious, is much more contagious. Some studies 2 times more contagious, some are 4, which is worrisome. This will spread really quick. That's what we're seeing in other jurisdictions. So I don't think a case number, on any given day should fall into what one does during a risk assessment, especially with what's happening right now, what we're going to expect to see. So our behavior should change just because we know what's happening. We know what's happening right now. We're going to have case numbers for the next 2 days. I can guarantee you they're going to be in the hundreds. And I think we just need to listen to the messaging, not worry about the numbers, limit those interactions, try to consistently interact with the same person or people. If you're sick, stay home, get tested, wait for that test result. If you're older, if you have a comorbid condition, if you're at risk, if you live with someone like that as well, take that into account in your risk assessment because you are at risk. You are at risk and you should limit your interactions with people as well.
From CHVN, Taylor.
Are there, so with the vaccine clinics, you said that there's some days off for the holidays, but why are they being closed when those are the days that people for sure have off and can go get a vaccine?
There are hundreds of locations around the province that people can go. I know some of them will be open on those days. Others will be closed. And so we really encourage Manitobans to try to get a vaccine on whatever day in whatever location that they can. And not wait until the 25th. If they have an opportunity in the evening or in different times of day to check and see who might be available to offer them that vaccine at those times, because we do have a wide variety of hours and locations available around the province.
Thanks. And at those testing lineups, we are seeing that there are some issues of road rage, of arguments, people getting into physical fights. In one instance, police were called. What is the province doing to get those lines down and make sure people who are in line are safe?
So on the testing side, I think there's a busyness there. There's a lot of people going for testing. I think there's a lot of people with symptoms out there as well. I think we need to be kind to each other. There's a lot of pressure on people. There's a lot of pressure on the system right now. We need to be kind. We need to, create expectations that are reasonable as well. I know on the province's side, on the municipality side, they have brought out individuals to help out in lines at the different testing sites as well. And from a public health perspective, we're looking at different ways to improve testing capacity and expand that testing capacity out as well. So work is being done on that. And once that's finalized, more information will be provided to the public as well in relation to that.
From the Winnipeg Free Press, Danielle.
Well, just to follow up on that, so provincial government documents say that testing capacity will run out in early January. So when you talk about adding capacity, what will that look like? And if Manitobans aren't able to get a test or a result in a timely way, what should they be doing?
So at the present time, testing capacity isn't exceeded. It is being pushed. So our turnaround time has increased a little bit over the last little short period of time. We are looking at other avenues in relation to testing to be able to expand that testing and to utilize it in a very effective manner where it makes a difference. So that would include the use of rapid tests. So again, we are working on this strategy. It's in development. It's almost finalized. Public health is working diligently with government to look at this and to make sure that that capacity doesn't exceed our ability from a testing side. And again, once more is done on this and it's finalized, we will provide that to the public as well.
You also mentioned that you're still seeing a lot of Delta in the positive cases. So what proportion of new cases are presumed to be Omicron? And if it's primarily Delta right now, is this increase that we're seeing attributed to waning immunity? Or is there something else going on here that Manitobans should be taking into consideration?
So with Omicron coming in, I mean, Delta was our predominant strain prior to Omicron coming in. We've only had Omicron in the province for a short period of time, but it is doubling. In other jurisdictions, it's doubling twofold, every 2 to 3 days time, depending on the jurisdiction. So we know that number is increasing. We're sequencing more that are sequencing in for Omicron, and we're screening more that screen in for Omicron, and we're sequencing those as well, and most of those end up being Omicron as well. So it wouldn't surprise me right now, and this is a little bit of an estimate where roughly one-third, between 1/4 and 1/3 of our cases are likely Omicron as of today. Again, we won't get those results for several days because once something, someone has a test, that test becomes positive. It takes 24 to 48 hours for that to come back, and then sequencing is done, which could take another up to 48 hours, or screening is done, which could take another 48 hours, and then sequencing takes another few days there afterwards. So we are going to see Omicron, just like in other jurisdictions, become that dominant strain. It's going to happen relatively soon. But I don't have exact numbers for you because every day those numbers change, and the way the numbers come in from a screening perspective and the sequencing perspective, it's hard to align those numbers. But that percentage or that proportion is increasing for sure.
From Global News Winnipeg, Marnie.
Dr. Atwal, the numbers are showing a fair amount of breakthrough infections. Could that be attributed to overall waning immunity as more people reach the 6-month mark, or is it maybe that some fully vaccinated people have been letting their guard down too much? What do you make of that?
Yeah, sorry, this was the second part to the previous question as well that I didn't answer, so I apologize for that. So, when we're looking at these infections, we are seeing infections in unvaccinated people. They are by far, more likely to become infected. The vaccinated individuals are becoming infected as well. And we're seeing those numbers climb as well. And, it's still Delta. But that happens because there's lots of virus circulating around. And even when someone is vaccinated, if you get exposed enough times, there is that chance to have that breakthrough infection. And there's likely is waning immunity contributing to that as well. So the longer one has been from their second dose, immunity does decrease a little bit. And that, might increase your risk that when you're exposed, you do get infected as well. And with Omicron, we know that 2 doses of a vaccine aren't as effective compared to what it would be for Delta. And we're still learning the percentages of this, the exact number, how less effective it would be. But we do know that 3 doses provides better protection, provides that antibody response in vitro. And that's why the 3rd dose campaign is very important for us right now. We need Manitobans to get vaccinated when they're eligible. If you haven't been vaccinated, get your 1st dose. You got your 1st dose. When it's time to get your 2nd, get your 2nd. If you're eligible for your 3rd, go get your 3rd. And I think that'll be very important for us to protect our acute care system.
Thanks for that. And for Dr. Reimer, just given how transmissible Omicron is, risk it could pose in a higher risk scenarios. I'm thinking of homeless shelters. What is the province doing to ensure that that population is prioritized when it comes to vaccination?
Yeah, so we do have teams that are going to shelters to offer third doses to individuals experiencing homelessness. Our public health teams continue to focus on the areas of highest risk. We also have, all of the personal care homes have already offered boosters to all residents in personal care homes. So that setting has already received the opportunity to be boosted for all of those residents. But we will continue to ensure that we have doses available for those folks who are not able to attend a clinic or a pharmacy or one of our vaccine clinics either, and make sure that they do have options available, like what you mentioned with shelters.
From the Brandon Sun, Karen.
Good afternoon, everyone. Going back to the studies that you were talking about in your opening comments, I just read one here from coming out of South Africa, where Omicron, of course, originated. They say that very preliminary studies show that they may have hit their peak, and cases appear to be trending down. So, are you following any of that study, and just considering the behavior of this virus, are you expecting this the same kind of quick peak and drop?
That's a great question. I think everyone's looking at evidence. I know there's a lot on media, social media regarding, different types of studies, and specifically, there's this South African study that's out there as well that people are looking at. We still have to learn more about the study and what are the nuances related to how data was looked at in that study. And it's always hard to do an apples to apples comparison when you're looking at populations without knowing everything that was in the study. Just for an example, in South Africa, the average or the median age of someone is 27. In Canada, that's 41. And that'll have a big impact on the implications of having severe outcomes. Also, vaccine uptake, the type of vaccine that's available, the rate of natural immunity with previous waves that occurred in that country. So there's a number of confounding variables that we have to look at. So we can't just look at one study and draw conclusions. It is nice to say and look at that study and say it's somewhat nice to see an 80% reduction, but what does that actually mean for Canada? And can that be replicated in other jurisdictions in other countries around the world or even in Canada? So, there is some better data likely coming from better data sets in the next week or so. We're waiting on that information. We meet with all of our colleagues from across the province with our national team, and our national team meets with international teams sharing all this information as well. And we scour through data like this and studies like this as well. So at this point, we can't really comment any further on that study. It's a single study, and I think there are likely some issues related to that study as well. But we need to continue to look for this evidence, and in short time, I think we'll have some better evidence in relation to the impacts of Omicron on vaccines, vaccine escape, and severity, which will help guide us from a public health perspective.
Okay, thanks for that. And probably just a follow-up on that, just for Omicron itself, have there been any word from maybe Moderna about a new vaccine coming maybe in the next 3 to 4 months that will actually be targeted against Omicron?
Yeah, Moderna is working on an Omicron-specific vaccine, but we know that we are months away from having that option available. They are going to need to do the studies that they had to do with other types that they got approved. And then once those studies are complete, they're going to have to go through Health Canada review like other vaccines had to do as well, because we need to make sure that we are offering a safe and effective product for Canadians. So I think that there's a lot of promise in what the companies can do, because mRNA can be adjusted much faster than other vaccine types. But much faster still means it will take months to complete the studies in a way that we can get reliable data. So the message for today is, even when we're talking about from Moderna, is that the booster is the best way to protect you, because even while it's not targeted at Omicron specifically, it has been shown to increase the ability of those antibodies to recognize Omicron quite a bit. So it was a 37-fold increase in the antibodies that could recognize and neutralize Omicron. So we do still strongly recommend, and really at this point, we're pleading with Manitobans to go and get their booster doses, because that is the best tool that we have to protect you against ending up in the hospital, ending up in the ICU.
Okay, thank you.
From CJOB Winnipeg, Abigail.
Hi there. Just to continue looking at the testing capacity right now, I think it's probably fair to say you can expect an increase of people getting tests after the holidays. So are you planning on looking at maybe opening more sites or expanding the hours come January, or even increasing lab workers?
So again, there's a lot of work being done on the testing side. So I alluded to this before. A whole testing strategy is being looked at. We know even right now it's busy. You know, there's not just COVID where people are getting symptoms with. There's things like RSV. We haven't had any influenza for the past 4 weeks, so that's good. But there's other types of viruses like rhinovirus as well that people have symptoms with. And this is the time of year when people start to get those upper respiratory tract infections. So they screen in for COVID. They are getting that test done. So a lot of people are getting that testing done. It hasn't been capacity has not been exceeded right now, but it is being pushed, and that is, increasing our turnaround time. So with the launch of our monoclonal antibodies, with antivirals coming in the future as well, and testing being an important part of this, because we want to be able to test and diagnose real quick to initiate those therapies as well, and knowing that Omicron is here, and knowing how quickly Omicron spreads or how contagious it is, we are working on that strategy. And again, once things are finalized for that, we would provide that to the public. And it is about expanded use of tests. That would be the basis of that strategy.
Thanks for that. I'm also wondering about an update on distribution of rapid tests. I know the Brandon School Division announced that they're getting them for K-6. Will Manitobans be getting an update before Christmas in terms of rapid testing, or will there be news after the holidays?
So we've been using rapid tests all through the pandemic in different situations. We're using it where it's most effective from a public health perspective. So we've used it in outbreak situations. We used it for, different settings, including hospitals. We've used it in First Nations communities for outbreak situations as well. And we're going to continue to look at where we can utilize those tests. From a education standpoint, Manitoba Education received a shipment of the Abbott PanBios kits, and those are being distributed out in kits of 5 to students if they choose to have that for themselves or the parents, and instructions on how to utilize that and how often to use the test will be provided with that kit as well. We have kits as well. We've been distributing about 500,000 kits in October, November, and December here. And we're looking to see how much supply we have going forward, where that supply comes from, how to utilize those kits. Again, we want to utilize kits where they're not wasted. We want to utilize kits and rapid tests in the most effective means. And that's that strategy we're working on. So again, I think, once that's finalized, and it should be finalized shortly, we will provide that information to the public.
From the Winnipeg Sun, James.
Good afternoon, doctors. If this new variant proves that it is less serious than Delta, could there be a silver lining involved here, just in terms of the rapid spread and the potential to bolster natural immunity?
Great question. So a lot of people have been talking about this. We know it's much more infectious. And we're going to generate many, many cases, and it's going to be hard to curtail the amount of cases that are going to get developed. So we have put in measures to try to curtail that. We have messaging out in relation to that. We're going to continue to look at the orders in relation to that. The question mark becomes, what is the severity? And that is a big question mark. There could be a silver lining here. So if it is, we know it's much more contagious, which means that a lot more people will likely have become a case in a shorter period of time. But from our estimates, it would likely have to be about 90% less virulent, or have 90% less severe outcomes compared to what we've been experiencing with Delta. So, that's a great question. We don't have the answers to that yet. And hopefully in a short period of time, we will get that answer. And the silver lining here is if it causes less severe outcomes or the same amount as Delta, our system should be able to manage. A lot more people will get infection and develop some natural immunity as well. And we're also ramping up our programs in relation to vaccinations to get, again, first doses out, second doses out, and now third booster doses. Because after this variant, to be quite frank, there'll likely be another variant. And I think we have to expect that. We have to learn how to manage expectations with coronavirus and what that future may hold.
Right. Well, thank you very much for that. That's it for me.
From CBC Radio Canada, Alexia.
Good afternoon to both of you. I want to follow up on a previous question about rapid tests. I was wondering about that because a week ago, Minister Stephenson said that the government and public health are working on a plan to make them more accessible in Manitoba. You talked about school, but maybe can you provide a little bit more of an update on those discussions? For example, will it be possible for Manitobans to grab some tests at a pharmacy somewhere to bring home and use when they will be necessary? Or maybe is there discussion about offering free rapid tests like in Ontario, for example?
So this has been asked twice now. I think I've really answered the question in detail 2 times now. Realistically, we're working on a strategy here, and when that strategy is available, we'll provide that to the public. It should be available very shortly, but this is a strategy with all of our tests and utilizations of our tests, and in relation to how it impacts case and contact management, in relation to how it impacts treatment with monoclonal antibodies, and also in the future antivirals. So it'll be all encompassing. I think it'll address a lot of the questions you have. I just don't have the ability to provide you exact answers as of yet, but it should be available shortly.
Thank you. Also, I was wondering about the outbreak in Beacon Hill Lodge, which is a facility managed by Rivera. And we remember what happened in some of the others Rivera's facilities earlier in the pandemic. So I was wondering if you can talk a little bit about that. What's currently happening there, if you know it, and is there any investigation going on right now?
So you said an outbreak at a certain lodge?
Beacon Hill Lodge long-term care home.
I don't know the details of that at the present time, so sorry.
From CBC Manitoba, Bart.
Hi, Dr. Atwal. Twice here you've said that testing capacity has not been exceeded. I understand that laboratory processing capacity has not been exceeded, but if people are waiting in line 4 hours, how is it possible that you claim that swabbing capacity isn't exceeded?
So at the present time, from my understanding, capacity has not exceeded. I mean, people are waiting in line. I understand that. There's a large demand on the system right now. We acknowledge that. And again, work is being done to alleviate some of those strains. But the system hasn't, from a testing side, been overwhelmed at this point. It's being stretched. The swabbing side, you're right. If there are lineups there, obviously, that is being stretched as well. And that is being looked at on a regular basis. I don't have any further details for you on that. I mean, this is something that's evolving very, very quickly. And I know there's been media on this for this morning already. I just can't share any more details in relation to the exact causes of that. And if we do have some information available, we could provide that at a later time.
Now, the reason I ask is when we saw long lineups in September and October 2020 in Winnipeg during at the start of the second wave, there was an ability to, more locations were added. The mobile testing sites were added. We saw these things ramped up. It wasn't easy, but I got to ask though, how accurate do you believe the Winnipeg test numbers are if so many people just went, to heck with it, I can't sit here for 4 hours. See ya.
Sure. And in relation to testing and some of the lineups here, again, this is where I think our testing strategy going forward will alleviate some of those issues and improve that access. So again, work is being done on that. It's almost final. That'll be available soon. In relation to missing cases and people, saying I'm not going to go get tested, obviously that is not what we're recommending from a messaging standpoint. We want to know about cases. We want to be able to ascertain where the cases are, and it's important right now to know, how Omicron is increasing within the province on a proportionate basis as well. We know, though, from previous waves and from blood sample studies, the Manitoba experience is for every one case we identify, we likely miss out on 3 to 4 cases as well. And likely with a much more contagious variant, that number is going to increase. I don't know what that estimate is at this point. I mean, I think we'll have some answers to that, but not right away. That'll take some time. So it is a challenge. I mean, this whole pandemic has been challenging. We've been challenged from the beginning of the pandemic in different ways. We've as a population, as a system, we've grappled with the virus and its impact and how it's impacted everyone. Different things have been pushed, and we responded to those things. Manitobans have stepped up. Manitobans have stepped up on more than one occasion. We're asking Manitobans to step up again. We have healthcare workers. We have all these workers involved in relation to testing in the lab. We have healthcare workers who are pushed to the brink. We have public health workers who are pushed to the brink. We have families pushed to the brink in general. And I know we're asking a lot from all these people. I just want to say thank you to all those people. But, the system is being stretched. Let's be kind and understand work is being done to help alleviate some of those issues that we see. We're always going to have some issues, and there'll be something else that comes up. I think we need to be realistic about that, but we're going to try to address that. And that's what we've always done. We've done what we can to mitigate COVID-19 for Manitobans, and we're going to continue our best to continue to do that.
All right, folks, it appears we have time for a few more questions. Please proceed.
Just maybe one in relation to vaccinations for other things such as flu and pneumococcal pneumonia. Do we have any numbers for uptake? Is it higher than last year, lower than last year?
We do have those numbers, but I don't have them in front of me. So if you want to send an email to our comms folks, they can pull for you where we're at with those numbers.
Okay, thank you.
Hi, Dr. Atwal. It's Danielle from the Free Press again. Just wondering if you can give us some insight into outbreaks and how many we're seeing in the province right now. What settings are being most impacted at this time?
Most transmission still happens at the household level. With Omicron, we have seen some outbreaks, related to different types of settings as well, including some businesses, not public facing. I don't have all the details of that, but that's something that we could see if we could provide to you. If you could just email the comm side, we could see if we could provide some of the background information related to that. I just don't have all that in front of me. Sorry.
I'm just wondering if we're expected to see numbers increase. I know today was kind of a bit of a shock for people seeing that 400 mark. And then with what we could see happen over the holidays, are you expecting numbers even higher?
I think, quite frankly, yes. Our numbers, again, have gone up 60% in 1 week, essentially, on a 7-day rolling average. I don't see that plateauing. This is a stark increase. That increase is very specific to Winnipeg right now. In other jurisdictions, in other regions, that is sort of a bit of a plateau, I would say. But I think with what's going to happen, we're going to see increases right across the board in all the regions. I think we're going to continue to see case numbers increase in Winnipeg. It's going to be hard to estimate because that other variable there is now Omicron. So I know a few weeks ago, before Omicron was here, I was looking at maybe 10% per week. But here, with 60% in 1 week, I know some of that is driven by Omicron. We don't know exactly how much is driven by Omicron, but I think a good chunk of it would be that I think we're going to continue to see case numbers rise. And that's why we shouldn't focus on a case number when we're looking at risk here. We're going through the holidays. We're messaging, limit your interactions. Limit how many different types of people you get involved with and interacting. Try to interact with the same number of individuals. If you're sick, stay at home, go get tested. If you're older, if you have a chronic health condition or you live with someone with something like that, really understand the risk here of bringing that home or getting exposed and bringing that home and having your loved one get sick or you yourself get sick. It's going to be a challenging holidays here. And I'm asking all Manitobans again, limit those interactions. This virus loves interactions, and this Omicron variant loves those interactions even more. So limit those interactions.
Hi, Taylor here. Sorry if I missed this, but are testing site locations going to close at all during the holidays?
Not that I'm aware of, no. They should remain open.
Dr. Atwal, I was wondering if Manitoba Public Health is planning to update its guidance on mask use for the public, given what we know about Omicron and even the airborne quality of COVID-19.
So work is being done on that right now. So I'm just going to plug in my phone here. My laptop wasn't working, so I'm just going to plug in my phone. My battery's dying. So work is being done on that right now. We're working with our national colleagues in relation to this to understand transmission related to Omicron and what prevention looks like, what PPE looks like in that. So there's a collaborative effort here. It is worrisome that it is spreading so fast, and it is worrisome that it is 2 to 4 times more infectious compared to Delta. So again, once the science comes in on there, I think we'll utilize that science to make those recommendations.
The key this here at CBC. How many of the test samples in the last few days, what proportion, what number have been sent to Dynacare's Brampton, Ontario Centre to process versus where you were last week?
I don't have that number, and I think we can get you that number, but we'll have to get back to you on that.
Dr. Atwal, it's Michelle from CTV. Wondering what you're hoping to learn in the extra 4 days you'll get by delaying school restarting to January 10th?
Well, so right now there's a lot of unknowns coming into the holidays. Realistically, kids are supposed to go back on the Thursday or Friday, and they're going to go back on the Monday for right now. I think that just provides a bit of guidance to the public and to parents and to kids that there's a lot of unknowns here. We really need to understand where we're going to be at, and it's really hard to predict the next 2 weeks here. First of all, we don't have all the science related to Omicron. By that time, we should have a lot more science. Our case numbers are going to go up. What does that mean on the acute care side? I think we have to understand that as well. And we're going to learn a little bit from other jurisdictions prior to that as well. So it really gives us a little bit of an opportunity to, think about things. Make sure that parents are aware that, they don't have to worry about the Thursday or the Friday right after the new year to kind of figure out, is it safe or are we going back to school, or what should my plans be? That this provides a little bit of guidance on, you have the opportunity to make, childcare arrangements and plan for that, and gives us a little bit more opportunity on the public health side to understand that risk. I don't think decisions are going to be made that late in relation to our recommendations, but we wanted to provide that safety net for those families to make sure that they had that childcare if need be. And again, it does give us a little bit more time to really decide on what we need to do about schools once the holidays are over. We understand the risk related to those holidays, because we know our case numbers are going to go up. We just don't know to what degree at this point.
Hi, Dr. Reimer. I'm sorry if I have missed this. Why are we not shortening the time frame for the general public for booster shots?
When we shorten the time frame, we do lose out on some of the effectiveness of the booster. And so we're constantly trying to balance out what the risks are going shorter versus the risks of waiting. So for those people who are over 60, we're saying that, getting the booster sooner when we know that we're about to see this wave is really important, because those individuals are still at risk of ending up in the hospital. Whereas individuals who are under the age of 60 have a much lower risk of ending up in hospital, even if they were to be infected. And so we want to try to balance those two things together. And also we want to make sure that we're focusing all of our resources on the people who are the highest risk. And we've heard about people having challenges getting appointments. So we're trying to do two things at the same time. One, we're trying to increase our capacity at all of our locations and with our partners. But then also we're trying to make sure that those people who are at highest risk will get first priority for those doses, so that we can help reduce the number of people who experience those severe outcomes.
Time for one more question.
Dr. Atwal, Danielle from the Free Press again. What do you worry about when we lose public health contact tracing? Like, what concerns do you have about the data that will be lost, that the transmission information that public health will receive? What is the biggest disadvantage from a public health perspective of offloading contact tracing?
So from a contact tracing perspective, I mean, public health will still be involved in those high-risk settings. What we had to do was choose here. We knew that we were missing out on cases before Omicron came. I alluded to that before. For every case we would diagnose, we missed out on 3 or 4. We missed out on all their contacts as well. So with Omicron, we knew what was coming, and we knew that case and contact management would be much more difficult and challenging to be able to do in an effective manner, because it is much more transmissible. It seems like people get sicker a little bit quicker as well with it as well. So by the time we were, found out about the case, had the test result, and knew about their contacts, the contacts were already out and about, and some of them were already getting sick. And then what we looked at was, what was our priority? Our priority here is to prevent hospitalizations and severe outcomes. We know we're going to generate cases, but that is the priority. And the best way to do that, the most effective tool to do that with is vaccination. So we wanted to ensure that we could ramp up and build up that vaccination capacity as quickly as possible, and get third doses into arms as quickly as possible as well. So that was a strategy there to focus on. We're still going to be aware of cases. We're going to look at the estimate number of contacts. So certain information will still be brought forth by the case, not named specifically, but numbers of contacts. And again, in high-risk situations or settings like schools or hospitals or certain environments, we'll have that information on contacts as well. And so we are going to lose some information in relation to contacts per se, the number of contacts, and there'll probably be some other things that we might miss out on. I have to think about this for a period of time. But in general, our focus here in the future now going forward is about case management. It's going to be about vaccine uptake. We have monoclonal antibodies coming out, which is a treatment. And on the horizon here, we have antiviral treatment coming out, and we need to be prepared for that as well. So strategically, we're looking at what's most effective and how to mitigate issues for Manitoba, and how to limit the risk for Manitobans. So we are strategically doing things here to make sure that Manitobans aren't impacted by severe outcomes in relation to COVID as much as possible, and have people in place to provide those services to ensure that occurs as well.
Dr. Atwal, Bartley Kivas here at CBC. In light of 10.6% test positivity in Manitoba, do you really think it's safe to have 7,500 people inside or 7,000 people at a Winnipeg Jets game on Monday?
So from an orders perspective, things have evolved very quickly. Let's face it, this is fast. And last week we had discussions, we made recommendations to government, announcement was made Friday. That came into effect, yesterday morning, essentially. We've already had a number of discussions. I'm missing meetings about those discussions right now. So we're having those public health discussions. And again, I think there'll be more recommendations are on the horizon, and I think you'll have to wait until decisions are made, and that'll be made public.
Thank you, doctors. Thank you, everyone. This concludes our Zoom session.